I often hear women say to me, I didn't think it would happen to me. Are you one of those people who don't think they could have a heart attack? Being a younger woman, I'm referring to late 40s and early 50s and slim, doesn't mean you're not at risk either. And often healthcare providers can even overlook the not so stereotypical heart attack patient. And this can play a role in how you are both tested and treated. The National Heart, Lung and Blood Institute, the NHLBI, says that heart disease is the leading cause of death for women in the United States. Approximately 1 in 5 women will die from heart disease. And this can be a woman just like you and me. So with this in mind, I implore you to be your own advocate. It's so important to educate yourself, think differently about your lifestyle, and push for your regular heart health checkups. Your heart and family will thank you for it. When you're in menopause, contributing factors to heart attack risk include, as I mentioned in the previous video, the decline in estrogen, and then there are the more well-known factors like hypertension, high cholesterol, diabetes, obesity, physical inactivity, smoking, and unhealthy diet and stress. And then there are overlooked symptoms or preconditions. The overlooked symptoms that may or may not be related to heart disease are shortness of breath, fatigue, sleep apnea, edema in the ankles and feet, indigestion, gastrointestinal issues, jaw and neck pain, back pain, dizziness, excessive sweating, a persistent cough and wheezing, and even heart palpitations. Overlooked preconditions: chronic inflammation, autoimmune disorders like rheumatoid arthritis and lupus, chronic kidney disease, mental health issues, PCOS, psoriasis, metabolic syndromes like non-alcoholic fatty liver disease, and oral health issues like gum disease or infections and inflammation in the mouth. Hypothyroidism is categorized as an overlooked precondition, which increases the risk for heart disease and heart attacks, especially in postmenopausal women. And my doctor has never told me this. Hypothyroidism becomes more common with age, and women are particularly susceptible due to hormonal changes associated with menopause. It's estimated that about 10 to 20% of women over the age of 50 may have some form of thyroid dysfunction, with hypothyroidism being the most common issue. Managing the combined impact of menopause and hypothyroidism on heart health involves a multifaceted approach that includes hormone therapy, lifestyle modifications, and regular monitoring of your heart. And the good thing is these will help you if you also have one of the other preconditions. Also, HRT. Here's a comprehensive strategy you can follow. In the last video, I already talked about the thyroid hormone balance, and now I'm going to go into other hormones in menopause, particularly the sex hormones that would need balancing. In particular, estrogen, which plays a significant role in cardiovascular health, and its decline during menopause can have various effects on your heart. Here's how these hormones are beneficial. Estrogen helps in cholesterol regulation. Estrogen helps to maintain a favorable balance of cholesterol by increasing the high-density lipoprotein, HDL cholesterol, which is the good cholesterol, and decreasing the low-density lipoprotein, or LDL cholesterol, which is the bad cholesterol. And this helps to prevent the buildup of cholesterol plaques in your arteries. Number 2, vascular health. Estrogen promotes the health of the endothelium, the inner lining of blood vessels, which helps to keep blood vessels flexible and responsive, and this could help reduce the risk of arteriosclerosis, the hardening and narrowing of the arteries. Number 3, anti-inflammatory effects. Estrogen has anti-inflammatory properties which can help to reduce inflammation in the cardiovascular system. Chronic inflammation is a risk factor for heart disease. Number 4, blood pressure regulation. Estrogen helps to regulate your blood pressure by promoting the dilation of blood vessels. Lower levels of estrogen during menopause can contribute to an increase in your blood pressure. Number 5, glucose metabolism. Estrogen influences how the body handles glucose and insulin. Proper regulation of glucose and insulin can reduce the risk of developing conditions like diabetes, which is a significant risk factor for heart disease. Number 6, protection against blood clots. Estrogen helps to maintain a balance in the blood clotting system, reducing the risk of blood clots that can lead to heart attacks and strokes. During menopause, the decline in estrogen levels can lead to an increased risk of cardiovascular disease. Hormone replacement therapy, or HRT, has been used to mitigate some of these effects. As always, the decision to use HRT should be individualized, considering the balance of risks and benefits for each woman. If someone is, for instance, grossly overweight and has an abnormal lipid panel and maybe multiple stents from a heart attack, then perhaps other therapies may be a better option. There should be a discussion between the individual and a hormone specialist who's up to date on the latest studies. I use a transdermal estradiol, which can help manage changes in my blood lipids associated with menopause, particularly the increase in the LDL, or bad cholesterol, and the decrease in HDL, good cholesterol. Transdermal estradiol, which is a form of hormone replacement therapy delivered through the skin via patches, gels, or sprays, provides estrogen similar to that is naturally produced by the ovaries before menopause. Several benefits of the transdermal estradiol include direct absorption. It is absorbed directly into the bloodstream, bypassing the liver, which can reduce the risk of some of the side effects associated with oral estrogens, such as the impact on liver metabolism and clotting factors. Secondly, lipid profile improvement. Studies have shown that transdermal estradiol can improve lipid profiles by decreasing LDL cholesterol and potentially increasing HDL cholesterol, as I've just mentioned. This can help reduce the risk of arteriosclerosis and subsequent heart disease. Number 3, reduced risk of blood clots. Compared to oral estrogen, transdermal estradiol is generally associated with a lower risk of venous thrombolisms or blood clots. Number 4, dosage control. Transdermal application allows for a more consistent control of hormone levels, reducing the peaks and troughs associated with other forms of administration like oral pills. I also take a progesterone, as this helps with sleep and moodiness, and sleep is important to manage stress. This you should take if you have your uterus, and even if you have had a hysterectomy. It can help you, as progesterone is good for your brain. Progesterone plays a crucial role in balancing estrogen levels in the body, as I mentioned earlier in this series, and this balance is essential even when overall estrogen levels are low. Estrogen dominance can occur when there is an imbalance between estrogen and progesterone, leading to symptoms even if estrogen levels are not particularly high. And here's why progesterone is so important in this context. Estrogen dominance. This condition occurs when there's too much estrogen relative to progesterone. This imbalance can happen even if the absolute levels of estrogen are low, as long as progesterone levels are disproportionately lower. Symptoms of estrogen dominance include weight gain, particularly around the hips and thighs, bloating and water retention, breast tenderness, mood swings, anxiety, irritability, irregular menstrual cycles in the reproductive years, fatigue and poor sleep quality, headaches or migraines, and even hair loss. Importance of progesterone. First, balancing estrogen. Progesterone helps counteract many of the effects of estrogen. It promotes regular menstrual cycles in the reproductive years, supports healthy pregnancies, and balances mood and energy levels. Number 2, reducing symptoms. Supplementing with progesterone can alleviate symptoms of estrogen dominance, such as mood swings, sleep disturbances, and weight gain. Number 3, bone health. Progesterone supports bone health by balancing the effects of estrogen. Number 4, metabolism and weight management. Progesterone aids in regulating metabolism and can help prevent the weight gain associated with estrogen dominance. Number 5, thyroid function. Progesterone supports thyroid function, which can be beneficial for individuals with hypothyroidism, as imbalances in thyroid hormones can exacerbate estrogen dominance symptoms. Progesterone supplementation. Forms of progesterone include bioidentical progesterone, which can be taken in various forms, including oral capsules, transdermal creams, and vaginal suppositories. I take an oral capsule called Ultragestin. Monitoring and dosage. It's essential to work with a healthcare provider to monitor hormone levels and determine the appropriate dosage and form of progesterone. Regular follow-ups and adjustments of the treatment plan are crucial for your optimal results. So to recap, even with low levels of estrogen, progesterone supplementation is important to maintain hormonal balance and alleviate symptoms associated with estrogen dominance, and is good for your brain. A comprehensive approach that includes lifestyle modifications, dietary changes, careful monitoring of your hormone levels can provide significant benefits and improve overall health and well-being, not just for thyroid issues, but other preconditions as well. Let's talk about testosterone. Indications for testosterone supplementation in menopause. First of all, low libido. One of the primary reasons for prescribing testosterone or asking for testosterone for when you're in menopause is to improve sexual desire and response. Second, fatigue and energy levels. Testosterone can help improve energy and reduce feelings of fatigue. Then there's number 3, muscle mass and strength. It can assist in maintaining or increasing muscle mass and strength, which declines during menopause. Number 4, mood and cognitive function. Some women report improvements in mood and cognitive function with testosterone therapy. Testosterone may offer some cardiovascular benefits, such as improved lipid profiles, vascular health, and reduced fat mass, which can contribute to better overall heart health. However, balanced levels are essential, and careful monitoring of testosterone levels are required, as too much testosterone also carries some potential risks, including increased cardiovascular events, polycythemia, and fluid retention. For women in menopause considering testosterone therapy, I recommend working closely with your healthcare provider or hormone specialist to tailor the therapy to your individual needs. Also, monitoring for potential side effects and to ensure a balanced approach to hormone replacement. Further research is needed to fully understand the cardiovascular effects of testosterone therapy in women. And I think that's coming along because they're recognizing the need of this important hormone in women. The sex hormones, particularly estrogen, plays a significant role in cardiovascular health, and its decline during menopause can have various effects on your heart. Join me in my next videos where I will take a deeper dive into healing the thyroid and living post-menopause with a liver detox, an adrenal recovery plan, and healing your gut. All of these are super important if you're suffering from a precondition that is adding risk to your heart health and health in general as you age and you want to live long and be strong to enjoy precious moments with your family, your spouse, your friends, grandkids, and even pets. and have a good quality of life, and generally you want to feel your best. Join me and find out how to thrive and feel vibrant again. If you found this video helpful, please like, share, and don't forget to subscribe to my channel. Cheers to a healthy heart, and I look forward to seeing you in my next video.